Hello, I am Dr. Chandra Shekar, consultant neurophysician at Prathima Hospital, Kachigoda. Today I am going to discuss briefly about the brain stroke. Brain stroke is an emergency condition. Briefly about the brain stroke, what are the causes, types, how to diagnose, how to treat. In this video I am going to discuss briefly. Brain stroke occurs when the blood supply to the certain part of the brain suddenly interrupts or stops either because of the blocked artery or ruptured blood vessel. Stroke occurs. Without the nutrients and oxygen from the blood, the brain cells cannot function properly and eventually die. This causes the brain stroke. The types of the brain stroke include ischemic stroke and hemorrhagic stroke. Ischemic stroke occurs when the blood supply through the blood vessel will not occur, either could be because of the blocked artery or narrowing of the blood vessel or any small blood clot which obstructs the blood supply to the certain parts of the brain. Ischemic stroke occurs when the blood clot occurs locally or when the blood clots travels elsewhere from the body. Locally, blood clots forms when the fibrous fatty plaques ruptures or cholesterol plaques ruptures, and it will give rise to the clot formations and it will blocks the artery that leads to the ischemic stroke. On the other hand, embolic stroke occurs when the blood clots from the heart or other parts of the body will comes to the brain's blood vessels, and in the small blood vessels obstructs and blocks the blood supply. On the other hand, hemorrhagic stroke occurs when the blood vessels leaks or ruptures. Hemorrhagic stroke occurs. It occurs because of high blood pressure or overuse of the antiplatelet drugs or overuse of the anticoagulant drugs. Sometimes abnormal formation of the blood vessels such as aneurysms and heavy malformations rupture leads to the hemorrhagic stroke. What are the symptoms of the stroke? The symptoms of the stroke include deviation of the mouth to either side, difficulty in speech or difficulty in understanding the speech, weakness of the one hand, that is difficulty in lifting the hand, or weakness of the leg, difficulty in walking, or sometimes associated with the swaying to either side while walking. Sometimes stroke symptoms also associated with headache, vomitings, dizziness, seizures, with loss of consciousness, sometimes with coma. How to diagnose the brain stroke? As soon as the patient presents with brain stroke in the emergency department, we have to examine the patient for clinical examination. As soon as the patient suspected with the brain stroke, we have to send the patient to the imaging, either to the CT scanning or MRI scanning. Why important to get the CT or MRI is the treatment which we are going to treat the ischemic stroke, we are going to give blood thinners, will aggravate the hemorrhagic stroke and that will increase the bleed. So that before starting the treatment, we have to differentiate ischemic stroke from the hemorrhagic stroke. As soon as we get the CT scan or MRI brain scan, we can diagnose the ischemic stroke and hemorrhagic stroke. How to treat the ischemic stroke? Ischemic stroke can be treated with blood thinners such as aspirin or tissue plasminogen activator, which is given intravenously. That is, if the patient presents with 4.5 hours of the brain stroke, we can give the IV tissue plasminogen activator intravenously, or sometimes it can be given through the intra-arterially locally. When the patient presents beyond the 4.5 hours window period of the stroke, we can remove mechanically the blood clot through the separate devices called mechanical device, and that is called as a mechanical thrombectomy. How to treat the hemorrhagic stroke comes. In the hemorrhagic stroke, we have to control the blood pressure, we have to reduce the vasospasm, we have to control the seizures. Whenever the hemorrhagic stroke occurs, the brain beyond the hemorrhagic stroke will lack of the blood supply, and sometimes hemorrhage itself cause irritation of the blood vessels, vasospasm, and it further leads to the lack of blood supply to the area which is present behind the brain. Hemorrhagic stroke, when it is big and it causes the raised intracranial pressure, then it may require to surgical decompression and craniotomy to relieve the blood pressure. How to prevent the ischemic stroke and hemorrhagic stroke? Ischemic stroke can be prevented by the controlling the risk factors like hypertension, controlling the diabetes, cessation of the smoking and alcohol, and physical walking. Lack of sedentary habits should be avoided. These can prevent the ischemic stroke risk factors. Whenever the blocked narrowed carotid arteries are there, it can be dilated through balloon catheter, or the carotid arteries can be stented through the guided catheter. Whenever there is hemorrhagic stroke, risk factors like aneurysms or heavy malformations are present, that has to be treated with coiling, embolization and clipping. Most important point in the brain stroke is to get the patient early within the window period, that is 4.5 hours. If we do IV thrombolysis, patient will recover immediately. That is the main aim of the reason behind this discussion.